You would probably know if your tooth is infected if you get an abscess, which is a bump on your gums, or you might have a swelling. However, if you have periodontal disease, you may not know that you have an infection until like years later, because that's such a progressive disease, and you may have starting getting bone loss like at 5 or 6 millimeter pockets, which is something that we measure, until you notice, oh, you might come and say, oh, Dr. Hines, I'm not sure what's going on. My teeth are shifting. You know, I have a bad taste in my mouth. I have swollen, puffy gums. Things are oozing out of there. You know, what's going on? So that's why it's so important to see your dentist regularly and get a checkup every 6 months so we can determine what type of cleaning you need, because sometimes you might need to come every 4 months. And whatever it may be, our major goal is to see how we can help you so that you can keep your teeth for a lifetime.